I'm excited to be here talking with you.
Yes, me too.
You have a great community, so I'm excited to speak with them today.
Awesome. Yes, and thank you for coming on, Michelle. So we will get started because I know we only have an hour because like you said, you are at work. So I appreciate you taking your time in the middle of the day to come on here. I'm very very grateful for that. So everybody, thank you for coming on and welcome to the Art of Mindful Medicine, episode number 25. Whether you are watching this live or not, it is all good. I appreciate you coming on here and. I am your host, Dr. Seth Gilson, biological dentist, certified yoga teacher, speaker, and personal coach. And like I said a few times, my very special guest today is Dr. Michelle Yanover. A little bit about Dr. Yanover. She is the founder and creator of Fuel My Smile, an online Instagram community sharing the benefits of whole food nutrition for oral and whole body health. She is a practicing full-time dentist, wife, and mother of two beautiful girls. She received her undergraduate degree at Emory University with a Bachelor of Arts in Psychology. She then went on to pursue dentistry at State University of New York at Stony Brook and graduated in 2010. Dr. Yanover also holds a certificate in wellness coaching from the Nutritious Life Studio. And something that Dr. Yanover shared with me that I would like to share with everybody that is going to be expressed all throughout this interview is the following. So she said that through my personal passion for fitness, nutrition, and my knowledge of the dental field, I have seen firsthand how important our nutrition is for oral health. The mouth is both a window and a gateway. How we nourish our body can either move our mouths towards disease or towards health. And I could not agree with that statement more. And the only thing I would add is that, and again, in this interview, we're going to show some of the ways that this significantly impacts overall health as well. So, and Michelle, thank you so much again for coming on here. And I always like to start with gratitude. So if you could please share with us 3 things that you're grateful for today.
Today, I'm grateful for my health. It's actually my 1-year COVID anniversary today. So this day last year, I was diagnosed very early on with COVID.
Wow.
So I'm feeling extra grateful today to not have COVID, to be vaccinated, and to that, my diet and my lifestyle, I think, supported a very quick recovery for me. So certainly grateful for that.
Mm-hmm.
And I'm grateful for a lot of the lessons I learned this year during the pandemic. So I spent more time with my family than I probably would have in a typical year because our schedules before between my children's sports and activities, my husband's work, my work, even though we're both working again, the quality of time and the amount of time that we got to spend together, I'm really, really grateful for. I've learned so much and have so much pride in my family and what we've been able to accomplish together during this tough time. So certainly grateful for that. And I am grateful for this community.
All
All
right.
right. Hopefully we stay connected. But I
Yeah.
actually see you now because for some reason before I didn't see you. So this is
Oh,
better.
okay. So good. I don't know what's going on with Instagram. This happens sometimes, and sometimes I have to go in and out 3 or 4 times before the other person can see me. So I'm happy you can see me now. So it should be good. Now it works. So
All right. Well,
anyways,
welcome back,
yes,
everybody.
welcome back. So we were just talking about gratitude because I want to be respectful of your time, and we got a lot to talk about. So we were just talking about gratitude. Your first thing was that you're grateful for being healthy and that you had COVID a year ago today, which is a crazy coincidence that we're doing this interview on the same day a year ago that you actually were diagnosed with COVID. And then also for your family and the quality time that you get to spend with your family. And then the last thing that you said, I heard about community, but then it got cut off. So I'll let you pick up from there.
So I'm super grateful for community, my personal community, but also this wonderful Instagram community, getting the opportunity to connect with like-minded practitioners like yourself. Um, you know, I'm one of 7 dentists in my family. All of us practice differently. That's one of the amazing things about dentistry. So being able to connect all across the country, the globe, the world, with like-minded practitioners who take a more functional and biological approach to their practice has been really wonderful experience for me. And then also connecting with those patients who are interested in it, whether for their own health or they know somebody who's suffering from dental disease or other issues. I also have some followers because I have an autoimmune disease that my diet and lifestyle and mindfulness has helped. So just connecting with people and sharing has is another thing I'm super grateful for.
Yeah, I think that's beautiful, and I do want to just briefly jump back to the second thing, the quality time with your family, and I think we're in a very fast-paced society, right? And everything's kind of been go go go, and where it just seems that the more modern we get, the more on the go we are, and I don't like to make. I try and find a silver lining in everything, and I think last year the silver lining was that we got some extra time for however you want to define time, but we got to spend extra time, or at least most of us got to spend extra time with some of our family, if not a significant part of our family. And I think that and your third gratitude, which is community, is so incredibly important to our overall health that, and it's not expressed enough. And I love the fact that that's what you're grateful for, because I think that's something myself, and I practice gratitude every day with my girlfriend. We message back and forth gratitude every morning, and I think that's something that everybody needs to be practicing, as well as show gratitude for something like that, because there's a silver lining in everything, and we might not always see it in the moment. We might not always like to think about it like that, and I understand that, and I don't necessarily blame people that don't, but it's really it can be beautiful depending on the perspective we have on life, right? So I really thank you for that, for sharing that.
Absolutely. You know, it's life's a journey and it certainly has its up and downs, but I think the choices you make, the way you choose to view your life, the way you choose to appreciate your life and find gratitude and mindfulness can really shape the journey that you're on, right?
Mm-hmm.
So something can happen to you and you can say, oh, why is this happening to me? This is terrible. Everything's wrong. And you can live in that. Or you can choose to, like you said, find the silver lining, find the joy, find the opportunity to thrive and to survive and not only survive, but thrive.
Yeah, absolutely. Absolutely. So one of the first things I wanted to talk to you about was, because I know you said you have an autoimmune disorder, and that can be very challenging for a lot of people, some more than others. But I wanted to know what the most significant challenge or adversity you've had to overcome is, and what lessons this has taught you along the way, along your journey.
So I think one of the things that many people with autoimmune disease struggle with is that it's an invisible disease, right? People look at you and, you know, I've always looked relatively thin and fit because I always did make, you know, being active a priority, but they don't see maybe how you're suffering. So I think that can be hard because you may put a smile on and try to get through your day. And it can really be a struggle. So I really empathize, and I see so many patients who have autoimmune diseases. They're so common, and a lot of these autoimmune diseases do have effects in the mouth. I suffered from a lot of dental disease actually, and my diet was not good before either. So I think the combination of a poor diet plus some of the issues with the autoimmune disease really, I've experienced almost every dental procedure in my mouth.
Mm-hmm.
So I can really empathize with patients about that as well. Another really unique thing that happened to me when I was having a flare, I was having a very bad toothache, and I was in dental school actually and didn't want to miss a day because I was worried about graduating. And that was the priority at the time. I was not taking care of myself. I want to be right there. I was not taking care of myself. And so I asked one of the attendings to anesthetize me, give me a block to get me out of the discomfort so I could continue for the day. And they agreed, and I actually felt my face get numb and then immediately unnumb.
Wow.
And, and I was like, they definitely were in the right area.
Yeah.
Because I definitely felt the proper anesthesia. If you've had a block, it's a very distinct, it's like up to here.
Yeah.
And I felt it get numb and immediately unnumb. And,
That's really
he gave me another one and same thing. I didn't maintain any anesthesia in that side. And I've had dental work there before. This was very unique. And I think it was related to whatever was going on in my body at the time, that my body had enough inflammation or issues going on that the body didn't want to accept, the anesthesia in the same way. The chemistry in that area probably changed. And I noticed this actually with a few of my autoimmune patients. If I've treated them with a flare, they have a harder time. So that's something that we're not taught in dental school, but as you practice, right, we have a lot of things in the way we practice that we're like, well, we weren't taught this in dental school, or I don't really know about this, but I'm noticing this stuff happen. So those were some of the things that started to happen to me to help me start to take this holistic, biological, and functional approach in dentistry. Just realizing that not everything in our books was exactly the way it translated into practice.
Yeah, and you just used the word that I was going to say, practice, and that's what. And I know a lot of people use this terminology, and a lot of people have said this, but whether it's dental school, medical school, naturopath school, whatever kind of school you're in, or it's law school, I mean, it's a practice. Once you just then you got a license, whatever that's supposed to mean, to practice in real life, right? And then we learn from there. And I know. I don't think you mentioned for everybody watching that might not know, what type of autoimmune disorder do you have?
So I have Crohn's disease, which is autoimmune disease of the GI tract, usually the intestines, but it can be from mouth all the way to the other end.
Mm-hmm.
And thankfully, it has been relatively well controlled. Other than that episode in dental school, which I was talking about, which ultimately led to me missing a week of my 4th year of dental school.
Oh, wow.
Because I ended up with fever and almost actually, to the point where my colon was so inflamed that I could have lost my colon.
Wow.
Thankfully, that didn't happen.
Absolutely.
And even that wasn't enough of a wake-up call for me to change my diet or lifestyle. So I wasn't there yet. I am ashamed to admit I was a 6-can of diet soda a day drinker in dental school. So I couldn't tolerate the coffee because of my Crohn's disease, and I was in a get through it, get done, graduate, get ready, cut teeth, do. And my mindset just wasn't there. There was not the space, I guess, in my life at that time for the mindfulness. But I got better. I got medications, and I got better to a controlled point.
Mm-hmm.
And then I did pretty well through my first pregnancy. I did great. And then my second pregnancy, which was a few years after graduating, I started to be sick again and not feeling well. And sorry about that.
That's okay. No, I know where you are, so it's all good.
And I started to not feel well again. And I was frustrated. I was having like rheumatoid type symptoms, blurry vision, muscle and joint pain. And that's not good as a dentist. And that's when I started to question, like, is there something else going on? Can I be doing more for my health and my well-being? And at the same time, sort of seeing the same thing in a lot of my patients, my diabetic patients, my hypertensive patients. I had patients on 3-month recalls, 4-month recalls for their gum disease. And I would clean and I would scale and I would do, antimicrobial treatments. And they'd improve a little bit, but they were never getting to that place that I really wanted them to get. And that's when it all connected that, hey, this is connected to all of this. And if we're not healthy with the way we're, what we're eating, our diet, our lifestyle, we're never going to get all of this back into balance or in a better direction.
Mm-hmm. Absolutely. Yeah. So it was a couple years out of dental school when you started to realize this, and then start to change your own lifestyle. It sounds like, right?
Yes, absolutely.
Wow. It's so tremendous to see how, because I mean, dental school, and like I said, any kind of medical school, it is what it is. But then when you get out and practice, you kind of, yes, there's CE courses, and then sometimes there's older doctors that are willing to share experiences and things like that. But you have to experience these things, and you have to witness these things to really start to understand and learn how this goes. And that's a great example of what you just explained of that happening. So I commend you for having the awareness of that, because obviously we are two of millions of dentists out there, many of which who are great practitioners and great doctors, but they just don't kind of put all these little puzzle pieces together, because we've kind of compartmentalized medicine. Like, the mouth is the mouth. We're just head and neck. We don't think about anything else. When that's just not how it works. And I mean, it's not unfortunate. I mean, fortunately, that's not how it works, because I think looking at a whole organism per se is the best way to cultivate overall health, right? So.
Right. And even the organisms that live within us, that's a passion of mine,
100%.
the microbiome.
Yeah.
And really that we're carriers of this other ecosystem that are mostly there to help us. People are freaked out. We're ultra aware of germs in this era, because of COVID, and to pluses and minuses for that. But, we really are these gatekeepers. I try to convey it to managers. We're like these gatekeepers to these bacteria that live with us, and the goal of oral and whole well health is to bring those, have the good ones doing what they need to do.
Mm-hmm.
The bad ones will probably still be there, right? Like there's P. gingivalis in most of our mouths, there's
Mm-hmm.
H. pylori in most of our guts, but most of us don't have the symptoms of it, because it's when those opportunistic pathogens take over. And that's really been fascinating for me. And I'm loving everything that's coming out with the science of the
Yeah,
microbiome.
it's been awesome, and we're definitely going to talk about that in a little bit. So I want everybody to stay tuned for that, because that is a really cool topic. And again, it's emerging research, and we're constantly learning. Like, I mean, I'm talking on a daily and weekly basis. Things are really coming out. So I'm really happy to get to talk to you about that. But one thing I want to talk about before is, when and why did you decide to become a wellness coach? And what exactly is a wellness coach for those of us that might not be so sure?
Sure. So, about 3 years ago now, I believe it is, maybe longer. I sort of lost track of time with this whole last year. Um, I started to work with a dietitian, Robin Berry. If you go to my story today, you'll see I've linked to her because we actually have a 21-day plant-based program that we're going to be sharing probably in about a month and a half's time, but we're
Beautiful.
taking the wait list interest for that today. And I started to work with her on my personal health journey and goals, because I did want to become plant-based, but I wanted to make sure I did it in a healthy way that supported my health goals and my Crohn's disease. And she was really knowledgeable and fantastic. And I always did love to cook, so that was a benefit to me, because I think cooking, or being at least confident in the kitchen, is really, really important for your health goals, because it's important to make as much of your own food as possible,
Mm-hmm.
because for most people it's not realistic to have a chef or to buy out all the time, because that can be quite expensive.
Mm-hmm.
And I started working with her. I had tremendous success in my inflammatory levels. My C-reactive protein levels went down. My colonoscopies looked great. And she loved the food I was cooking, because I was teaching her a lot of new recipes as I got more involved with it. And she said, I think you really have a knack for this. I have a certification in this Nutritious Life program, and I think you would really love the program. You should take it. You'd have an opportunity, at least twice a year, to speak to these patients about your experience and your knowledge. So, to her guide, I signed up for the program. Amazing program, amazing knowledge. Carrie Glassman is the registered dietitian. She's kind of been the guru on TV for a long time. And she's become a wonderful friend as well from the program, and her huge support. And I learned so much, not only about nutrition, but wellness and a more holistic approach.
Beautiful. Awesome. So do you like take on clients online or anything, or do you just incorporate that in your practice?
I just incorporate it into my practice. I've thought about it, but I work with Robin a lot. If I have patients who want referrals, I
Mm-hmm.
certainly refer to her, because she lives locally to me as well. Or I have a community of dietitians I can recommend to other people. Um, Dietitians really, really know a lot and study a lot, and I think don't get credit. It's definitely different than somebody who's a wellness coach. That can mean a variety of things. Like
Yeah.
registered dietitians, they do residency type of programs,
Mm-hmm.
just like we do. They understand medical needs on a way that most people don't. So I do tend to refer that stuff out, when it really is related to medical or specific goal needs. But I always have very open and candid conversations about my patients and their overall dietary pattern for
Mm-hmm.
their oral health.
Beautiful. So one of the things that you mentioned before, that you alluded to, was about mindfulness in our field and in general. Being that obviously we're both doctors and we're both in the same field, and I certainly know how high paced things can be and how high stress things can be in the office. What are some of the things that you do to prevent burnout, as well as cultivate empathy and mindfulness with your patients, and also in your private life?
That's a great question. And that's one that is definitely a work in progress for me. I think growing up, I was a very type A personality. I always wanted to achieve high levels in school. That was important to me. I always liked hearing praise back from the teachers, and that was important. But as I practiced more and developed more, I sort of went through this phase a few years of getting into practice too, where I was a little bit dissatisfied. I kind of felt like I was living in what I call the gray, which is an okay place to be. Like I had achieved all the things on my list of things I want to achieve. I had become the doctor. I had become, the mom, the wife. I had the house I wanted. And I kind of just felt like I was in this gray and I didn't know what to do next because there was no more measure, no more direct measure of my success,
Mm-hmm.
right? Which was tough to kind of feel like. And then I thought back to the things I've learned in life experience. I said, well, like, there doesn't need to be a measure of success. Your journey is your journey. And I took time to kind of look back on me and not what the next goal was, but how to be the happiest, most content version of myself. And for me, that's exercise. And we talked about meditation. I've been working on meditation over the last year. I got a lot better at it during the pandemic. But you brought up a point which I love. You're like, cooking's your meditation.
Mm-hmm.
Like you're focused on that thing and it's bringing you joy. And I thought about it like, you could find me in the kitchen. That's my meditation. That's my music. That's my zone.
Mm-hmm.
That's where there's a symphony going on in my mind and it's beautiful. So that for me is super important. And then this community has been a great way for mindfulness. And I've learned from so many of you guys, yourself. I have other friends on here that have taught me so much about mindfulness and reading and always being a student. I love learning and always being a constant student.
Yeah, that's so true. I actually just made a post. Yeah, that was yesterday. But when one teaches to learn, and it's, I mean, I saw that and I'm just like, yes, obvious. I mean, because there's learnings going on all the time if you're open to it, right? If you're open to hearing what others have to say and how others see the world. I mean, you don't necessarily even have to agree with what other people are saying, but just to be open to exploring those other things that are going on, because there's always an opportunity for learning, and that's what practice is, right? So
exactly.
I think that's beautiful, and I definitely, like I said, and like you said that I said, you're cooking. I mean, you can see it in the food, like the pictures of the food, like you just know that's. I mean, that's what I know you're going to be cooking forever. So
Yes. Yes. I sure hope so. It brings me a joy that I can't really describe. So.
Yeah, I can definitely see it. And one of the other aspects of this is that I know, and as well as that dental anxiety is widespread. So what are some of the tools that you utilize to comfort patients in your practice?
Sure. So I think that's, being a psychology major was super helpful.
Mm-hmm.
And that always felt natural to me. Understanding that patients, most of them don't want to be there, or most of them can't, there's a need that you have to understand between a need and a want, right? Like a lot of patients need things, but don't want
Mm-hmm.
the things per se, or they may know they need them, but they haven't accepted it. I sort of make a joke with you. You'll see a patient with a ton of tattoos, but then they're, petrified to have dental work done with local anesthesia, and totally understandable because pain is so real to people on different levels. And that's something that you have to understand too. But I think, that patient could have the tattoos without the discomfort because they wanted the tattoos. Their body was open to that idea of that being there,
Mm-hmm.
but their body's not open to the idea of you coming into their mouth, a personal space, and they're not ready to receive it. So it is scary for them, and understanding the patients where they're coming from. And everyone's different. Not one thing, at dental school for kids, they teach us a method called tell, show, do, and that works for some.
Mm-hmm.
But some kids just seeing something is going to make them not comfortable in the chair.
Mm-hmm.
So really, taking time. I do with certain patients desensitization visits.
Mm-hmm.
That may mean just coming in and sitting in the chair for one visit, coming back 2 weeks, and today we're just going to count the teeth. Another visit, we're just going to take the x-rays till they can sit comfortably in the chair. And then there is patients who have greater needs than that and, can be addressed in other ways as well. But, the patient is first, right? We're nothing without our patients. We can know all the skills, have all the knowledge, but if we don't have patients to serve, then, we don't have a job to do.
Exactly.
So, really just so important to take that little bit of extra time with your patients, which can be hard, especially, I'm an associate, which means I don't own my own practice. So there's ways we work differently in different practices.
Mm-hmm.
So still just trying to find the time to connect, trying to figure out what's going on. And then if you count level in, people with the patients with their parents, that can be a whole nother level of dynamic. So,
Yeah.
trying to explain to mom, well, I know you came today. I know you had to take off work today. That was hard, especially things, but today so-and-so's just not ready for this. And, we can do it, but like, could we do it in a way where everybody has a good experience so that if she needs something else again in the future,
Exactly.
it's a positive experience. And really just educating that we're not just, drilling, filling, and billing,
Mm-hmm.
that we're doing more, that we want our patients to get better, that we want them to feel comfortable. We do, right? We feel terrible when we know our patients are in pain. At least I do.
Yeah, no, it's tough sometimes. I mean, and they people won't necessarily say it, especially kids. But you can see it in their eyes, and sometimes it's just like, okay, let's take a break.
Mhm.
What's going on? What are you feeling? What are you thinking about? What do you want right now? Like, and I think that's mindfulness, right? I mean, that's empathy. That's how you care and show essentially love to people. And I know that's a term that a lot of people might use for other things, but I mean, when you're just showing presence and you're being present with somebody, you're just showing them love, and that's something that we, especially as practitioners, just need to make sure we're doing more of all the time, every day, even when we're not at our best. So, and
Absolutely.
that's the only way it gets
And
reciprocated too.
that can be challenging. I coming to work with, and it's been a bad day or a bad morning, and trying to push that aside. That's all a practice. It's never perfect. I failed at that before.
Mm-hmm.
I've definitely let what's going on outside of work affect me at work, and I'm learning and growing, and that's the best we can do, right?
Exactly, 100%. So I don't know if maybe you use some suggestions at work, but what suggestions do you have for people to start incorporating mindful practices in their lives?
So I think first, a gratitude journal can be really great, or like you said, you text, whatever way it is that you just put it into words. A gratitude journal. I did this with my daughter. She went through a phase at the beginning of the pandemic where she said, like, everything is bad.
Mm-hmm.
Today was a bad day. Today was a bad day. I said, every night, just write 3 good things that happened today. Just write 3 good things. No matter how big or small, write 3 good things. And the first day she said, well, I can only write 1 thing. I said, okay, so write 1 thing.
Mm-hmm.
But then, every day she started writing it. And then I said, look back at it. Was every day a bad day? Every day you were able to put at least 1 thing,
Mm-hmm.
3 things, sometimes more things. And what I noticed is as she did more and more, the list got bigger and bigger. She found it herself, right?
Yep.
She found through writing it and putting it there the way to change her mind frame and to change her perspective. So putting it into writing, or people like vision boards, that can be really helpful.
Mm-hmm.
And finding a community that supports you is so important.
Yeah.
Reaching out, there's pluses and minuses to social media, but a huge plus is that there are communities out there, and asking for help if you need help. That's important too, because like I said, most of us are in a mindset of more worried about what we have going on ourselves to sometimes see the pain that other people are in. So not everyone knows what you're struggling with. So not being afraid to share, because there are people who want to listen and there are people who want to help.
Yeah, and like I said, that reciprocation kind of process, it really does work. And between that and, like you said, a gratitude journal or whatever kind of system you want to set up, just like you explained with your daughter, I mean, that neurologically changes things in your brain and in your nervous system, and it really does work. And there's a lot of research to back that up for people that are skeptical of it. You just have to do it, and how long I might have to do it for may be different than how long you have to do it for, and what works for me might not work for you. But it's just playing with things and having fun with it, because you only got one life, right? I mean, you're here, so enjoy it. Try new things, do things that make you feel good, and just go out and explore and try these different things that don't take a whole lot of time, and they're free, and you have the time. I mean, you have the time. If we have the time to complain about something, we have the time to fix something. So,
Right.
All right. So let's shift a little bit and get back into talking a little bit more about dentistry and some of the things that we do relating to overall health. So Why is it that you chose to focus on food, and when did you first make the connection between diet and dental health?
So I think I touched a little bit
Yeah.
about my own journey and how I got there. So, you know, the microbiome, it comes back to the microbiome for me and the influence of what we eat and our microbiome and these bacteria and how they're constantly communicating, right? We know that patients with Alzheimer's disease, they're finding bacteria P. gingivalis in their brains on autopsy. We know
Mm-hmm.
they're finding bacteria in people's heart from heart attacks and atherosclerosis that was in the mouth. It's all connected. And how does that happen? Like the underlying process of inflammation, right? And it's driven by a lot of things, but of one very large component is our diet.
Mm-hmm.
And if we're eating the standard American diet, the SAD diet, I think it's so appropriately named, or the modern
Oh wow.
American diet, the MAD diet, but
Yeah.
they're sad and mad.
Mm-hmm.
They really are.
Right.
It's full of packaged and processed foods. So these refined foods where the nutrients and the benefits that are supposed to be in our food are all stripped. And we're not nourished, the majority of people are not nourishing their body with real food that's going to help them thrive. The message that the bacteria in your body get from the refined grains and the sugar, is to feed the bad bugs. They're kind of like the bad bugs are kind of lazy. They don't want to work hard, so they take the easy energy, right? And they use that, and in the mouth they excrete acid, which increases your risk for tooth decay. They also make these inflammatory cytokines and molecules that increase inflammation, and they're doing the same throughout the body.
Mm-hmm.
So again, all connected. But these good bugs, and this is where I led me on a plant-based diet, thrive off of fiber, right? And fiber is only found in whole plant foods.
Mm-hmm.
You can add fiber supplements. I'm not talking Metamucil or you know foods, because then the whole foods are wrapped in fiber.
Mm-hmm.
And that means you get the phytonutrients, the antioxidants, the polyphenols, the vitamins, the minerals, all in this beautiful package with the information the good bacteria need to thrive.
Mm-hmm.
And those get broken down in the gut, and they make short chain fatty acids that decrease the inflammation. It's been related to better mood, health, all of these things, really, really powerful. But also in the mouth, what most people I don't think even realize is that we have an enzyme to break down simple starches. We have salivary amylase. That's where digestion starts. So the white flour, the sugar, is easily broken down there.
Mm-hmm.
But the foods that are rich in fiber, right, the salivary amylase can't work on it. So you're eliminating, the higher risk foods by incorporating more whole plant foods into your diet. You're also stimulating saliva, which is super protective. So I really looked at the plate and he said, the standard plate that's kind of grain heavy, animal protein heavy, doesn't really make a lot of sense for us. We need to really focus, on adding diversity of whole plant foods to our plate to really thrive and give our body the information it needs.
Mm-hmm. So for some people that might not be sure, what exactly is the oral microbiome? How would you describe someone that doesn't have never heard that term before?
Sure. So, the microbiome in the mouth, when we talk about it, we're mostly talking about bacteria, but there's viruses, there's fungi, these archaea, and there's, viruses in the mouth as well too. But overall, there's bacteria that live in our mouth. They live on our teeth, our gums, in our throat, they're in our nose too, which you could argue whether that's part of the oral microbiome or not. I think it is. If you're breathing through your nose, the bacteria are communicating there. And these bacteria are like an ecosystem, like a rainforest, kind of, and they're trying to fight for survival. And again, most of them are there to help us or to not do damage. They're kind of just surviving there. But we can cause shifts, right? We can cause shifts towards disease. We can cause shifts towards health. And that's what the information we give these microbes. And a big part of that is the food again. So, when we have health and balance, you have mostly good, helpful organisms. But when you have disease, when you have shifts, when the diet's poor, when they're smoking, alcohol use, stress, you could see a shift this way because the good bugs get frustrated, the bad bugs are getting what they need, and then we start to see problems in mouth, tooth decay, gum disease, and sometimes much, much worse. We've seen, you can see tumors, you can see growth, sores, very painful things for patients related to a shift in that microbiome.
Yeah, I think one of the things that you said before about some of the bacteria in the mouth is that they're opportunistic. Can you explain what that is for people?
Sure. So The microbiome in disease is really about opportunistic bacteria and then how the body responds to those opportunistic bacteria. So, again, if you're indulging, say, in the simple carbohydrates, white flour, and sugar frequently, the certain bacteria that prefer that are going to stay around because they're getting the food they need, right? You feed a stray cat, it's going to keep coming back because they're getting the food supply they need. On top of that, if the mouth becomes dirty, they build these homes, they build these things called biofilms, like literally little houses or structure around them to protect themselves. The bad guys, they don't need oxygen, they don't need it there. So when the mouth is dirty on top of bad diet, they can really do their damage. The good guys need oxygen, they start to go away, and we see more and more of these bad ones causing problems. They're able to get into the gums more, down, open up, people talk about leaky gut, like leaky gums. Our gums are permeable to begin with, but they can become super leaky. You've seen the patients, you know what I'm talking about with severe periodontal disease. If one red blood cell can escape from your gums, right? Bacteria are like 8 times smaller.
Yeah.
How many bacteria are
Yeah,
going
you just actually made a post on that, I think. Yeah.
Yes.
So
Yeah.
that was really good information. And I, by the way, I just want to say I love so much of what you share for people. It's so educational, and the visuals are really good too. So with
Thank you.
you're welcome. With the opportunistic bacteria, I think what people really need to grasp is that like you said, the more you feed those bad bacteria, the more they get comfortable there, the more they reproduce there, and then they take over the environment that the good bacteria in your mouth need, because like you said,
Right.
the good bacteria in your mouth need oxygen, so they can't survive underneath the gums where there's very little or no oxygen. And the more, that's why we measure the gums and to see the kind of pockets that people have in their mouths. There's a reason that we do all of these things. And I know a lot of people that come to dentists don't necessarily want all of these things done, but it's really, really necessary. And as you said, the leaky gut and there's leaky gums. The oral tissues are the most absorptive tissues in the body. And there's a reason for that. It's because it's the first part of our GI tract, our gastrointestinal tract. I mean, and this is something that I'm constantly talking to the patients about too. So this is such an important concept for people to understand. And like you said, it is linked to so many other diseases, chronic disorders that, of course, I say of course, but there's been a lot of research and talk about this for years about diabetes and cardiovascular disease. But cancers and, like you said, Alzheimer's disease, autoimmune issues, there's so much more that this is tied to that people really, really need to get a hold of, and that just simply brushing and flossing, and obviously coming in for cleans, but just what you do at home, brushing and flossing is so easy and so important, and we just kind of breeze over. And I'm not. How is it with your practice and maybe the other doctors that you've worked with and things? Because I stress this so much to patients because it's so easy and, like I said, free for people to do. And I just don't seem to see that many other practitioners that I personally have worked with doing it. Obviously, they talk about it, but not to the extent that I really think is necessary.
Right. And I think people don't understand there's a big divide too with it's just baby teeth, right? and we see there was a 2019 study in the Journal of American Medicine that showed there was evidence of coronary artery disease on children who had passed from other reasons on autopsy in as young as 10 and 11 years old. Fatty liver disease used to be a disease of alcoholics only, and now it's being diagnosed in toddlers, right? There is something significantly wrong going on, with our diet and our lifestyle that's encouraging these diseases to thrive. And I think a big part of it is the microbiome, right? Our genes code for information for proteins, but the microbiome shifts which one of those get turned on. That whole concept of epigenetics.
You took the word out of my mouth.
and so we want to say my family has a horrible history of cancer in it, and I can't promise that my diet and lifestyle is going to prevent me from even getting one of those cancers in the future, but it's going to support me to be less likely to get it. And if I do, it's going to support my healing or the progression of the disease in a way. And I know that. So it's worth it. Some people feel like, well, I can't stop it, so I'm not going to stop and do anything about it, right? That's so many of our patients. And that's the hard part to communicate. It's when we're ready to hear and when we're ready to listen. But I think as providers, it's so, so important to keep saying it, because you never know when that patient in the chair is ready to hear
Yeah,
it,
and
right?
and you might not know that just that one sentence that you say might impact them to start that journey. So
Yeah.
it's not about whether, of course, it's when they're ready to really take on that challenge or that reality. But it's just, the path starts before you actually realize that you need to make a change.
Right.
So it's so incredibly important. So moving on, I want to ask you a question. Why did you shift towards social media as a good outlet to teach people about the oral health and the oral microbiome, as well as nutrition?
Great question. I can only see so many patients in a day, right? And we just talked about, like, maybe one of those patients will be interested in what I have to say, maybe not. But social media does offer a platform to reach more people, and people who are seeking the information. And then those people help because they share what they heard,
Mm-hmm.
because they understand it, they've heard it, they've seen the benefits, right? And then they share and it spreads and your community gets bigger. So social media, there's definitely pluses and minuses, but the the message of love, of health, of joy, of finding that mindfulness and sharing that, I don't think that could be a bad thing. I think putting that in the universe, more people who believe that, is a good thing.
Yeah, absolutely, 100%. And there was a question from somebody that's watching. There's this new feature on Instagram where you can actually write a separate question, which is actually pretty cool. So the question was, what can you do to get your children to eat more vegetables or veggies? And I'll defer to you on that one because.
Look, man, it could be a challenge, right? And I get asked this a lot because when my kids were little and I had total control, there was definitely more variety. Then they get older, they go to school, they're exposed to different things.
Mm-hmm.
I think it is important to keep giving, keep putting them on the plate, keep showing them, and you lead by example, right? So if you say, I don't like broccoli, like, why are they going to like broccoli? But if they see you eating broccoli, you don't have to say, I love broccoli. But if they see you every day eating broccoli and 7 other veggies on your plate, usually one of my kids will look over and be like, that looks good. Can I try that? Right? And we discover we like a new vegetable.
Mm-hmm.
And they may like it raw, they may like it cooked. So usually what I'm doing, people ask, well, do you cook separate meals for yourself and your family? It's a combo. I always make like a Sunday soup for myself, so I have something that I'll be satisfied with for the week. And then, but whatever I chop up to go into the soup, I leave some of that aside. They get some of that. They get a version of it. Sometimes they like the soup. They eat the soup. Sometimes they don't. But the same vegetables and proteins get offered, to them in just different ways, and keep showing them. It takes multiple exposures for a child to accept a new food. And, my broccoli loving 7-year-old now doesn't like broccoli all of a sudden, but he likes Brussels sprouts.
Oh
So,
wow! I
that's,
used
that's
to
okay.
hate Brussels sprouts when I was little. Now I love them. Like I can eat them alone. I mean steamed, even raw. But I know that's unusual for a lot of people. So, but I think, and another important thing I think is important to note, and again, I don't have as much experience with this with kids, but certainly with adults, when you change your diet, I'll say this, before you change your diet, what you eat impacts your palate. So the more you start introducing new varieties of different things, your palate actually changes, and that also changes your brain, because whether it's
Exactly.
sugar or carbohydrates that turn into sugar, or whatever food you're eating, I mean, it activates certain networks in your brain to say, oh, I like that, or oh no, I don't want that. So I mean, the more you introduce something and the more healthy foods that you eat, and the longer you do it for, then you try and go back to have something that's sweet or whatnot, and you just don't like it. So
Yeah. And another thing that worked for me really well with my own kids, but I also do it with patients, is I have them do an Eat the Rainbow challenge.
mm-hmm.
And I tell them every week on your refrigerator or wherever you most often go to look, write down the colors of the rainbow and write one fruit and one vegetable from every color that you're going to try to eat this week, and it's just incorporating more variety, getting kids involved. I know now you may not want to take kids to the grocery store because of the pandemic, but if there's an opportunity, if there's an outdoor farmers market, some way for them to pick and to see if they can touch it, if they can feel it, that really helps. If they can get in the kitchen with you and help chop it, taste it, we're chopping veggies. They say, here, try it, see how you like it this way. Now try it this way cooked.
Yeah, no, that's a
Even
great
if
idea.
it's one bite, it's just introduction and the concept, and then you're modeling constantly.
Yeah.
Right, the way that you eat. They see you every day eating a burger and French fries. They're going to think that that's a meal, right? We talked about the concept of the plate, and I said, to me, a meal growing up, and nobody fed me particularly unhealthy food. What we thought at the time was healthy, but to me, a meal growing up was like, what animal protein, what grain, and one vegetable. Right, that was a meal, which isn't a terrible plate overall, but what's missing from it is the variety of the plant foods. And now a meal to me is how many different plants can I eat, in this meal, and different ways to do it, and different flavors, and using spices. Spices are plants too. They're nutrients. They're more information. They adding flavor but nutrition to your dishes.
Yeah, herbs are a medicine, to be perfectly honest.
Yeah.
So, and there was another question that I want you to quickly address. It's obviously related to what you were just saying. Some of the top veggies that you'd recommend for kids. I mean, of course, I think that depends on the kid. And I mean, they're not just because one's extremely nutrient dense doesn't mean every kid's going to eat it. But
right. You could look. If you only ate kale, you wouldn't be a healthy person. There's very amazing nutrients in kale, but if you only eat kale, you're missing out on other important nutrients. So there's no one food, but I find one of my kids likes things raw, one of my kids likes things cooked. So we just try. But one that surprised me that both my kids like, and I've told people, and there's a lot of success, is red cabbage. Just sliced red cabbage.
Wow.
So my kids love that, and that's also in the brassica family, those cruciferous vegetables, so the same family as like broccoli, kale, arugula, Brussels sprouts, and those are really, really, again, very nutrient-dense foods. Yeah. They have amazing phytonutrients in them.
Absolutely.
But that one goes over really, really well in my house, so maybe that will work. But kids tend to go easily for the peppers or the carrots. They're a little bit sweeter. Yeah. But they're also amazing. Those colors are information about the nutrients in those foods, and eating colorfully should be the goal.
Yeah.
So
I think, like you said, variety and try the rainbow is really a good methodology for parents to work on, and just being consistent. And like you said, and like some other people have said in the comments, I forgot who made the comment, but modeling is so important. The kids watch what their parents do, so be very aware of what you're doing, not only what you're eating, how you're reacting to what you eat, and your just overall attitude when you're around food and things like that. All these little details, they do make a difference.
Yeah, and I have 2 daughters, so I think it's very important they're watching and listening to. Boys do listen to this as well too, about how you comment, how the food makes you feel, or not being. My battery's gonna go soon, but
we're almost done. So
eating for health, eating for health, eating for your wellness, right? And eating to feel our best, and those are different ways to talk about food. The way our relationship with food is really, really important.
Yeah, absolutely. What's one thing you wish everyone knew about their oral health?
I wish everyone would. Sorry, I lost you for a second. I'm back. All right.
One thing, what?
I wish everybody would floss. I really do.
Yeah. Oh.
I keep it simple, but people have probably heard me say this before. Bacteria poop in your mouth every minute of every day. That means flossing is like wiping your butt. Just think about it that way.
Yeah. Okay. I'm going to use that. I haven't used that one yet with patients, but I am going to use that one, especially with kids. I literally could not agree with you more. I cannot tell you how much I stress this with patients. It doesn't matter what your age. It is so important to floss your teeth. I mean, it's just as important as brushing, and most people realize how important brushing their teeth is. So definitely floss. And I always tell people at night before you brush is the most optimal time to floss. So
that's exactly what I recommend as well. Get it out before you brush at night.
Exactly.
And do it. If you do it once a day, that's great. If everybody flossed every day, I would be the happiest person in the world.
To be perfectly honest, it makes everybody's lives easier. It makes my job easier. It makes the patient situation much better. I mean, it doesn't take a lot of time. I think what a lot of people don't understand is because they don't do it because, oh, my gums are bleeding. Well, the more you do it, the less your gums will bleed. Obviously, coming in for cleanings is important when you get to that point, but the more you do it, the better it gets, because the oral tissues, like I was talking about before, are the fastest healing tissues in the body. So
Exactly.
it's really, really important, people. Please
And also,
floss your
you
teeth.
don't go to the gym and immediately lift 200 pounds,
Yeah.
right? Start somewhere. And it hurts when you first go to the gym, right? You first start lifting and you're in pain and it's sore.
Yeah.
Eventually, once you get your muscles to where they need to be, it no longer hurts. Then you go up again. Just flossing every day can be such an important tool to your oral health. And
Yeah.
again, bacteria poop in your mouth every minute of every day.
Mm-hmm.
So flossing is like wiping your butt.
Yeah.
No poopy mouths.
Yeah, exactly. Exactly. All right, a few more questions. Are there some people who may get recurrent cavities despite maintaining a diet that supports a healthy mouth?
So absolutely this can happen. And that's so frustrating, right? Like patients could be eating really well. But one example I can think of is patients with Sjogren's syndrome, right?
Mm-hmm.
That's an autoimmune disease. And they're probably not producing enough or adequate saliva. And our saliva is a huge protective factor in our mouths. So if we don't have those protective factors there, you're going to be at higher risk. And then mouth breathers, right? People who are breathing through their mouth and their mouth is open all the time. Your diet can be good, but if your mouth's open, it gets dry. The saliva is not cleansing the teeth. There's not the exchange of the minerals that we need to see. Certain areas of the mouth can become more prone to cavities. So
Yeah.
diet is certainly very, very important. I think it's the foundation for many people, but a good dentist should be able to help you support and find the other reasons, the root causes for what's going on, why there's recurrent issues.
100%. 100%. Is there a particular toothpaste that you recommend?
So I really like Risewell. Have you used
Oh, I love
Risewell?
Risewell.
Yeah.
So I recommend this to all my patients. And I have the link. I have the link in my
Yeah.
profiles. People can go use the discount code. They're It is a really good company. And there's a lot of really cool research around hydroxyapatite, which maybe we can get on another live and talk about in a little bit more detail, because
Sure.
it is a really good product. And I mean, I think even the toothpaste tube, I think even is fully recyclable or
Yes.
compostable or something.
Compostable, I'm
Yeah.
pretty sure.
So
But
that is awesome.
they're a great line. I really love the founders too. They're wonderful. The dentist and the family that was also involved with finding great product, great mission. I love it, and that's what we use in our house. And they make a kids one
Yeah.
that tastes like frosting. To be honest, it's
Yeah.
called birthday cake, but it
Yeah.
tastes like frosting. It's
Yeah.
delicious, and you actually could eat it. You don't need to. You
Yeah.
don't want to, but it's safe enough that you could eat.
Yeah,
So I love it.
that's one of their mottos, actually, that it is safe enough to eat. Like you said, not that you recommend it, but I mean, there's kids that, especially when they taste something good, they're going to swallow it. We agree again. So I think we're like 3 for 3 on those a few different issues. So definitely everybody check out Risewell. I know I have a link in my profile. I'm sure you have a
I
link
do
in
as
your
well.
profile. So either way, just get it. They have a floss that's also infused with hydroxyapatite, which is an alternative and much healthier remineralizing agent. Please go check them out.
And the scrubby floss is awesome.
Yeah.
I think like it doesn't compare to any other floss I've used. So what it does is, I wish I had it on me, but it's sort of like a little sponge. You pull it tight to
Yeah.
get it through your teeth, and then you can let it go, and it's like a little bit
It puffs
spongy,
up
so
again.
it really gets everything out of there.
Yeah. It is a really cool product. Okay, 2 more questions. If this were, again, this is the one of the closing questions that I always ask. If this were the last time you ever had to share your thoughts, and you could only share 3 things that people should start implementing in their lives immediately to improve their health, what would they be?
The first, having love and empathy, like really is just so important, because that's going to open you up to the rest of it, and love for yourself and love for others. And that comes back to mindfulness and plant-based lifestyle as well, but love. And then patience with yourself on your journey is really, really important. Understanding that your body is an organism and it's on a journey, And so it might have damage, it might be on a path to healing, but it might not be there as fast as you want, and that's okay. Being patient with yourself. And third is to make the time to prioritize your goals, to do the important things to maintain your health goals.
Yeah, absolutely. I totally agree. Um, Great recommendations. And I just want to honor you for a moment before we close, because again, like I said before, I really appreciate what you're doing. There's not a whole lot of dentists that are online sharing the things that the way you do about nutrition and food, and it's just it really is impactful because you make it real for people. Because I mean, you from sharing recipes to just giving these little everyday tips, they're really is special. So I do want to thank you for that. Is there can you do a quick recap on like how people can follow you, connect with you? Do you offer any kind of courses or any project? I know you said you were working on a challenge that you're going to be offering in about a month or so.
Sure. So you can find me most easily at on Instagram at fuel_my_smile.dds. So fuelmysmile.dds. The MY, which most people don't know in my, is my initials, Michelle Yanover. So,
Oh, there you go.
yeah, and that's where I'm most active. I'm working on my Clubhouse game. I guess I'm old now, and I'm like just not so hip with this. And I haven't been able to do Twitter. So really Instagram. If you're in Connecticut and you're looking to come see me, I work at an office called Pure Smile CT in Branford, Connecticut in the Shoreline, and happy to see patients there as well. And then where else can you find me? I think those are the main two places to find me. You can DM me if you have questions. I can't answer specific dental questions for you. That's not legal to do over the internet, but I'm happy to help guide you in directions. And any way I can help you find what you're looking for. If you're looking for a particular recipe or advice on that I can help you with.
Yeah.
So feel free to DM me and reach out to me that way.
Yeah, absolutely. I definitely go scroll through some of her profile, people, because there's some awesome food on there and there recipes and things. So definitely go check that out. All right. So in closing, I as always, I always welcome everybody's comments, feedback, and suggestions. They're always welcome. Please check out the episodes on my YouTube channel, The Art of Mindful Medicine. You can check out my website, www.mindful.doctor. And of course, the shows are always on Instagram Live, and I'll always announce at least a few days before when the next episode is going to be. And my very last question for you is, I know everybody has their own way of describing this, but what does mindfulness mean to you?
Mindfulness means being able to both be present, but when needed, reflect back, and then what you put out into the world again, like what you're giving overall to the world. We're all going to have good and bad days. We're all going to have our ups and downs. Mm-hmm. But what's the overall message and meaning and purpose to you? Like, how do you find that inner peace and comfort in your own life?
Awesome. Beautiful. Beautiful. And as always, I always end with a quote. This is from Plato. Never discourage anyone who continually makes progress, no matter how slow. And I could not agree with that more, because we are all on our own path. Whether we realize it or not, we're all on this little ride together. So enjoy it. Have an awesome day, everybody. Michelle, thank you again so much for coming on. Thank you very, very much. And everybody, as always, remember, stay awesome, stay mindful, and I'll see you next time.
Bye.
Bye-bye.
Thank you.
Of course, thank you.